You know, our bodies have these incredible protective barriers, from our skin all the way to the lining of our stomach. But what happens when those barriers break? Or what if our body builds a tunnel that doesn't really go anywhere? Well, today we're going to dive into three medical terms that are often mixed up: ulcers, sinuses, and fistula. Let's get right into it. First things first. We hear these words all the time, right? Sore, fissure, ulcer. It's easy to think they're all kind of the same thing, but they're not. So what is the real difference? Well, it actually comes down to one simple thing: depth. How deep does the break actually go? Okay, check this out. This image is a perfect way to visualize it. Think of it like a map of a break in your skin. You've got these really shallow scrapes, some deeper cracks, and then what are basically potholes. Let's zoom in on each one, and we'll start with the one that's barely scratching the surface. So at the very top level, we have what's called an erosion. This is just a little bit of damage to that top layer of skin, the epidermis. A rug burn is a perfect example of this. And the good news, since it's so shallow, it almost always heals up without leaving a scar.
Now, if we go a little deeper, we get a fissure. This isn't a wide open wound. It's more like a really sharp, deep crack. Imagine a split in the tissue. A classic and pretty painful example is an anal fissure, which can happen from things like trauma.
And that brings us to the main event, the ulcer. The huge difference here is that an ulcer is a much deeper break. It punches right through that top layer, the epidermis, and gets all the way down into the second layer, the dermis. And because it's a way more serious injury, it heals a lot slower. If you don't treat it, it can even start to burrow down into the fat and muscle tissue. Yikes.
But let's be honest, when most of us hear the word ulcer, we're not thinking about our skin, are we? We're thinking about that awful, gnawing pain in the stomach. So let's switch gears and take a look inside.
This right here is a peptic ulcer. It's the exact same idea we just talked about, a break in a protective barrier. But this time, it's happening inside your digestive tract. As you can see, there are two main spots for it. If it's in the stomach itself, it's called a gastric ulcer. And if it's in that first little bit of the small intestine right after the stomach, it's a duodenal ulcer.
So what could possibly cause that tough stomach lining to break down? Well, it usually comes down to two main culprits. On one side, you've got this pesky bacteria called H. pylori, which can actually live in your stomach lining. And on the other, you've got the long-term use of NSAIDs. That's stuff like aspirin. Those drugs can mess with the stomach's ability to protect itself from its own acid. And when that protective lining is gone, you get the classic symptom everyone knows: that distinct burning or gnawing pain right in the upper part of your belly. That is literally your powerful stomach acid irritating the raw, unprotected tissue underneath. Now, even though H. pylori and NSAIDs are the direct causes, certain things can definitely raise your risk. Both smoking and drinking a lot of alcohol can weaken that protective stomach lining, making you much more vulnerable. And like with a lot of things, if ulcers run in your family, that can play a role too.
It's not always just about that main pain in your abdomen. Other signs can point to an ulcer too. People often complain about bloating, feeling nauseous, sometimes even leading to vomiting, and, in some cases, losing weight without trying to.
So how do doctors know for sure? They usually have two main tools. The first is an upper GI endoscopy, where they use a tiny camera to go down and literally look at the stomach lining to see the ulcer. And second, of course, they'll run tests to see if that H. pylori bacteria is hanging around.
Okay, so an ulcer is a break in a surface. Got it. But what happens when the body builds a brand new tunnel from a surface that leads absolutely nowhere? This brings us to our next topic, the sinus. So the word sinus literally just means a cavity or a channel. And we all have normal ones, right? Like the sinuses in our face. But every now and then the body can form an abnormal one, a little blind-ended tunnel. And the perfect, if kind of weird example of this is something called a pilonidal sinus. So what is it? A pilonidal sinus is a tiny tunnel that forms in the skin right at the top of the buttocks. And what causes this strange little tunnel to form? Well, the image here gives us a pretty good clue, and the answer is surprisingly simple: hair.
So how in the world does this happen? Well, it all starts with loose hairs collecting in that little cleft. These hairs can carry bacteria with them, which kicks off an infection under the skin. Your body's response? It forms an abscess, which is just a pocket of pus. As that abscess tries to drain itself, it carves out a tunnel to the skin, and voila! That tunnel is the sinus. All of that from just a loose hair?
Now, because this is a physical problem, there's an actual tunnel there. Pills aren't going to fix it. Really, the only dependable treatment is a surgical procedure to completely remove that sinus tract. That way, you get rid of the whole structure so it can't cause problems again.
All right, so we've covered a break and a barrier, that was the ulcer, and we've covered a tunnel that leads nowhere, that's the sinus. So for our final piece of the puzzle, let's talk about the fistula, which is an unwanted connection between two places.
A fistula is basically an abnormal tunnel that connects two places inside your body that should absolutely not be connected. It could be a link between two internal organs, or maybe it connects an organ straight to the outside of your skin. You can think of it as a biological wrong-way street that the body built by mistake.
And you can see two really different examples of this right here. On the left, we have an arteriovenous fistula. This is where the body accidentally creates a shortcut between a high-pressure artery and a low-pressure vein. And on the right is an anal fistula, which is a tunnel that goes all the way from the inside of the intestine out to the skin, and it's often the result of a previous infection or abscess.
Just focusing on that anal fistula for a second, it tends to be more common in men, usually showing up between the ages of 20 and 40. It's often linked with things like inflammatory bowel disease, and the symptoms are pretty much what you'd expect from an infected tunnel: pain, swelling, and yes, drainage.
So let's put it all together one last time with these super simple analogies. An ulcer? That's like a pothole, a deep break in a surface. A sinus is a blind tunnel, a path with only one opening that leads nowhere. And a fistula is a wrong-way tunnel, an abnormal connection between two places that shouldn't be linked. Pothole, blind tunnel, wrong-way tunnel.
You know, it's pretty incredible when you stop and think about it. Your body's a master engineer, constantly repairing and rebuilding itself. But, as we've just seen, sometimes when it's responding to an injury or an infection, it builds the wrong path. And in a way, these mistakes are just a powerful reminder of how incredibly complex and fascinating our own biology really is.